I think the pathology is actually the most shocking. We have angular limb deformities, for example, right? In America, kids with genu varum and genu valgum, nothing like you see in other places in the world. Everything I know about rickets, I learned there, not here in the US, right? I learned in Uganda. Bone infections here, right? They're often caught and treated with antibiotics and don't progress significantly. 20% of our surgical population at the hospital that I work at in Uganda is chronic osteomyelitis with like severe bone loss. And so seeing like the team over there actually is phenomenal in how they treat long segmental bone defects. And I think I've learned a lot from them. So I think the pathology and just like congenital conditions that are not able to be addressed until the child is significantly older. Even clubfoot, which is one of my areas of focus. I meet babies practically in utero here in the US, and we start their casting, at 1 to 2 weeks of life. And over there, we sometimes don't get to meet kids until they're 15 years old. We also meet a lot of babies, and there's many more babies that we take care of there than I might in my own practice here. But just the breadth of pathology is very different. I think other things that were surprising is that, or just make me take pause all the time, right? Is that here in the US, I have floral machines that work all the time, and we have electricity and running water that's predictable. And that's not always the case in all the centers that I've had the opportunity to work at in other countries and in Uganda. And I think there's a lot that we take for granted here, right? If you're doing a case and you need something else, you can call for it and it comes right up from CPD and you keep going. And over there, we have to be much more thoughtful, like ahead of time, to make sure that we have the equipment that we need, because you can't necessarily go and ask for a different tray. And you don't always have like all the screws that you want or the right plate, right? Like we're so fortunate here that we truly have anything and everything that we could really want. And the rest of the surgeons of the world do not have that luxury, and they have to be a lot more thoughtful and a lot more creative. And I've learned so much about trying to not overutilize resources, because here that is not ever a message that we are taught. And over there, even like being conscious of how much suture you're wasting is something that you really have to think about, because the resources are very limited. I actually think that's why it's so great when our trainees have the opportunity to go and work and learn from people in places with less resources, because it teaches us to be a lot more thoughtful about how we utilize resources in our own system. And I think it teaches us a lot about how we can provide better care to our own patients based on what we learn and see in other places.